Good morning, everyone, and thank you, AIOC, for giving me this opportunity to talk about elevating glaucoma diagnosis and management with Zeiss Forum Glaucoma Workplace. So, one of India's primary challenges in managing glaucoma is the population burden. Even with a diagnosis rate of less than 10%, the disease burden in the country is significant enough that most cases of glaucoma must be diagnosed and managed by general ophthalmologists as opposed to glaucoma specialists. Blindness from glaucoma is preventable, but only when an optimum timed intervention is offered. As a caregiver of a chronic disease like glaucoma, which requires lifelong care, we need to manage the data of our patient. So why data management is essential? So today's practices, the challenges faced are, we have more patients, we have less time, our reduced staff is there, sometimes increased disease burden in the society, and to keep pace with the technology, we have multiple diagnostic modalities in our clinic, which add to our data overload, manual interpretation by the clinician leading to missed pathologies, and delays in decision making. So data management is essential to save time, cost, material, and space. It supports fast and confident decisions. It reduces the data management complexity. So the integrated diagnostic imaging platform from Zeiss, also known as Forum, it combines the data and presents the critical information from multiple Zeiss devices into a single integrated point of view for a more efficient and insightful treatment decisions. So this is the first screen of Forum. As you can see, it's a patient directory where you can see all the patients. I have a cursor. Yes. So the topmost is a toolbar where you can search putting the patient's ID, visit date. We can have the refresh button on the right hand top corner, and if you double click on a patient, you get all the reports done on that particular date. The next slide shows the document display. The left hand upper corner gives the patient identification. 2 is a preset which is collapsible. 3rd is a toolbar, and 4th is a work area where we get all the documents or the reports which are done. 5th is a visit selection with filter option. So visit history. All tests or examination results, they are assigned to 5 categories like OCT, fundus imaging, visual field, biometry, and others. If a test was performed during a visit, a colored bubble is shown in the respective category. You can see which documents were done per visit and select the visit or the modalities accordingly. A single click on a preset arranges the documents in a clinical relevant way, saving the time. You can see all the reports on one single screen, and a clinician can give an interpretation. The 3 main features of a glaucoma workplace are interactive HVF visual field data, the structure function glaucoma progression analysis, and a combined structure function reports which comes in 2 forms, 24-2 or 30-2 with RNFL and 10-2 with ganglion cell analysis. So this is how a GPA analysis report looks like. A here is showing the baseline visual field. B is a glaucoma hemifield test. C is the current selected follow-up examination of the current date. D is the GPA or the deviation from the baseline or showing the event analysis. E is the GPA alert. F is a visual field index plot which is showing the trend analysis of visual field index. G is a VFI bar giving us remaining useful vision, and H is the rate of progression or the significance of progression analysis. Now it is possible to perform the mean deviation trend analysis based on the hemifield. Above graph, it is showing an overall mean deviation trend analysis, whereas the middle one, it is showing the trend analysis of mean deviation is of the superior field, and the inferior graph is showing the trend analysis for the inferior field. So we have a more localized assessment of the rate of progression. If you want to look at how the superior field is behaving, so we can just select the from the drop down box the mean deviation superior. So there is another feature which is there in this plots. There is this clinical event which allows us to set marks marker to highlight any performed intervention for a quick reference. Either you have changed, added an AGM, or you have done a surgery, so you can put add here, this after a right click button. So consecutive dual baseline, this another feature, it lets us to compare the rate of progression before and after an intervention was done for the assessment of treatment effectiveness. And next slide shows us how we change the baseline. You drag and drop the baseline to a new follow-up examination. So suppose we want to see, we added a drug here, another drug, and we want to see now how the patient is progressing. Is it worsening, or is it same, or we need to add another drug? So we can have two baselines. This helps us to compare and plan for the patient. In glaucoma, perimetry and OCT, they are both essential for diagnosis and management. So this forum gives us an advantage of structure and function report, where it combines the HFA GPA and the Cirrus GPA together. So this is how a structure and function GPA screen looks like, where we have these graphs, and we have a drop down box from where we can select whatever indice we are looking for. This will give a trend analysis of visual field index. It has mean deviation, then again superior, inferior, average RNFL. There's a lot of list from where we can select. Majorly what we are doing is we are checking for visual field index and an average RNFL thickness, or wherever we want to see the GCL IPL thickness. There are 4 charts, and we can simultaneously have a trend analysis of the different indices on one screen. It also gives us an option of timeline deviation mode. Deviation mode here is showing deviation from the normative data. Then we have a thickness and a sensitivity mode, which shows RNFL thickness and the GCL thickness. As we drop down and take the cursor down, we have timeline of the data tables, the key indicators. They are all arranged in a timeline, and we can see how the fields are progressing. And similarly, we have ganglion cell progression. So we have multiple options. It depends upon you, the clinician, what is he interested in. We have the RNFL quadrant and the macular sector timelines as well. The best thing about the forum is we can generate a structure function report. So structure and function report, it combines both the visual field and the structure of the OCT RNFL fields, and it gives an integrated comprehensive picture of how what is happening in the structure and the function of the patient. So this is a report. How this appears is we have the patient information on the left side corner. We have the field, we have the gray zone, we have the total deviation plot, the pattern signal, and the key indicate. We have these statistical values of VFI, the false positive, negative. On the single sheet we give, and the down here we are seeing the RNFL thickness, the RNFL quadrants, and RNFL and the GCL. So this is these are superimposed here, and the data is flipped, and you can see the right side is showing both structure and functional loss, whereas the left side is normal. Another feature in glaucoma workplace is mixed strategies. If you have done CETA standard in the patient, and now you are doing you have done a CETA faster, if you have to have a combined report, you can just select the mixed strategy and you will get a mixed GPA with CETA standard and CETA fast. So the OPD has now become from this, where the doctor is struggling with all the reports, and every time the patient comes, we forget the previous reports. We ask for the patient. Patients are not getting their reports. They forget at home. So it becomes very difficult for the clinician to decide now what to do, and it becomes very confusing. Now, because we are not dependent whether the patient has got his reports or not. His only file is lying there, and we have all the reports in front of us on the screen, and we can tell him how he is behaving. Now, what does the glaucoma workplace offer? It gives us confidence. It gives the detailed analysis of report. So better prepared when we see the patient, we have better communication leads to better compliance. The clinician is able to explain the disease, how it's progressing, and the patient is able to see his data and will be more compliant with the drops, and we can keep our patients in-house. Efficiency, it everything comes on a single screen as you are seeing, and it's an easy layout. Yes, initially we also struggled, but now slowly things are getting in place. However, you need, for a trend analysis, you need 3 to 5 years of data. You need 5 visits of HVF and OCTs. So it needs time, and glaucoma is a chronic disease. The patient is going to be with you for a long time, and if you can manage the data properly, you will be able to predict how he is going to behave in the near future. So GPA advantage, it is that you have, we can archive the data, we can generate the reports, and the best part is the structure function, GPA. So Zeiss Glaucoma Workplace is an invaluable asset to the glaucoma practice, as it adds value to the better management of glaucoma for the patient as well as the physician. Thank you.
Yeah, that's a nice talk. Any comment from anyone? Ma'am?
Well, excellent presentation, and I think this is something, I would say the biggest strength of such platforms is to be able to collate clinical, functional and structural data together. Archiving the data is still possible these days with EMRs. You can have previous reports with you and you can collate, but generating those graphs, giving you the exact trend analysis of superior field separately, inferior field separately, correlating it with OCT, looking at your optic disc picture, saves so much time.
Yes.
And makes us more efficient. This is one good example of how AI can help us improve our function and can be useful for benefiting us. I really dream for a time when we are not even dependent on which machines we have, like for a Zeiss platform. You need all Zeiss equipment to be able to collate that data. I feel that we should be able to get a platform in future where any machines we are using, whatever structural and functional measurement we are doing, whether it is Octopus, Humphrey, Triton, Zeiss, and we should be able to collate everything so that our clinical decisions become faster. Thank you so much for
Yeah, and another thing I would like to add, the Zeiss forum does not correlate the 10-2 fields with the GCC, which is actually needs to be incorporated, which I have already talked to the company person, they should do it.
10-2
Macular function is not incorporated.
macular function is not incorporated.
So
Yes, ma'am.
which needs to be added. I've already talked to Zeiss, they should add that software as well.
Thank you, ma'am.
Anybody has any questions?
No. It just gives us the timeline. Suppose you have a patient for the last 3 years with you, so every 6 months if he's coming, so every 6 months you have a fundus photo and you can see from the previous photo how the cup disc ratio and everything is. Yes, definitely. These pictures, not the, I think the educated patients. Only the educated patient, because it's not easy for the village people to understand all these graphs, but it definitely helps when we are dealing with the class of educated people, and helps the more compliance. I think patients become more compliant. They know what is going wrong with their eyes. They know what their IOP should be and how. It IOP is also you can add. Yes, you can get a IOP. Thank you, ma'am.